Welcome to this third virtual Medicaid Town Hall. I'm grateful for everybody being here. I'm also grateful for all the presenters we have this evening. Just to give you an idea, this is a program where we will go over some initiatives, but we've got Director Souza on the line. We've got Rick Brooks, who's going to talk about some workforce initiatives. Andrea Rohrer from Gainwell is going to talk about the support from Gainwell. We'll hear from Melanie Robinson to talk about how community health workers can help in dental offices. We heard a little bit about community health workers last time, but we'll hear a little bit more. We've got Abby Stenberg-Napton to talk about the patient experience and how much dental work can make a difference in people's lives. Last week, we heard from Omar Reyes, who talked about how people he works with in order to get jobs really need the help of dentists. And I say last time, but I encourage everybody, if you were not present at either of the previous sessions, you can listen to recordings on the YouTube channel. Finally, we'll have Sophie Assa will review some of our work we're doing in the pilot program, and then we'll have Christy Durant from the Rhode Island Dental Association. So once again, grateful for everybody for being here this evening, and I'm going to turn it over to Director Souza to share some words from the Medicaid program.
Good evening, everybody. I just wanted to stop in and just say hello, happy holidays to everyone. Let you know that we're excited to have a lot happening with oral health here in Medicaid. For those who aren't aware, which I think probably everyone on this call is, we had a very successful budget season this past July 1st, where our oral health rates were increased. We're hopeful that was an effort that has been in the works for many, 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 many years. And we were finally able to get it over the finish line. So very exciting for us. And we're hoping that will help us with access and the things that we struggle with in Medicaid from an oral health perspective. And we're hoping to build on that momentum with the various efforts that both the Medicaid program and EOHHS whole are trying to push forward. In particular, we have submitted a couple of different initiatives for the next budget cycle to hopefully build on some of that momentum and continue to stress the importance of oral health care for our population and all of those who we serve. So I just wanted to say hello, to say happy holidays, and to thank you all for all the work and all the efforts to try to improve the health and well-being of our beneficiaries here in Medicaid and really overall for our state. Thank you for having me. I hope everybody enjoys their holidays and New Year as well.
Thank you so much, Kristen. All right, so next, I'm really excited to introduce, for those who haven't met, Rick Brooks. All of us are thinking about workforce in the work we do. It's been really challenging for many fields, and definitely including dental. EOHHS has been doing some exciting work, and I'm grateful for Rick to share some of that work with us today.
Happy to be here. Thank you. Yeah, so good evening, everybody. Thanks for having me here. I'm going to probably zip through this a bit, and some of it may be familiar to you and some might not. As Sam just said, workforce challenges are pervasive throughout health and human services. Certainly in the dental field, workforce challenges have been around for a while. They're not actually new challenges, but they were made a lot worse during the pandemic. People leaving the workforce or leaving the health and human services fields, selling flowers, whatever they might be doing, something less stressful, perhaps less concern about infectious disease and so forth. And that has left those in the field with the challenge of backfilling, staffing, recruiting new workers, keeping the ones we have. And all that's made more challenging by the fact that we're in a tight labor market and people can shop around for jobs. And if wages are not competitive, that makes it that much more difficult. Before we get into some of the planning work we're doing, I just thought I'd share just a little bit of data. I'm not going to spend a lot of time on this. This shows the total number of dental assistants, hygienists, and dentists that were employed in May 2021. I should point out that survey data is not 100% reliable. It's what we have to work with. You will see to the right-hand side, the Bureau of Labor Statistics also does projections every couple of years. They update their 10-year projections. A couple of things of note. As best as we can tell, looking at this, the numbers in 2020, at least for hygienists and assistants, were significantly higher than they were in May 2021. That may be because of people leaving the workforce. It may be because practices they wouldn't have been closed, but they may have been, the volume might have dropped, or they simply might have just had fewer staff. Those numbers dropped in 2021, but it's interesting to look at those 10-year projections and to see that while there's very little growth between 2020 and 2030, the numbers fairly flat. The total number of openings is substantial. So that's not about growth, that's about turnover. And that in turn is about how do we get new people into the field and how do we keep the ones we have. The other thing I'll just note real quickly from the Department of Health's licensure data, we also know that the number of actively licensed dentists has dropped. In 2021, it was 792. In July of 2022, it was 652. That's a significant drop of active dentists. So because of these challenges in terms of recruitment, retention, I should mention also the challenges we have in terms of the diversity of our workforce, especially as we move up the ladder. We unsurprisingly lose diversity, and our licensed workforce is less diverse than our population in Rhode Island as a whole. So we undertook, the Office of Health and Human Services, along with the Office of the Post-Secondary Commissioner and the Department of Labor and Training, a Health and Human Services workforce planning process, and really not just planning, but implementation. This isn't about studying a problem for a couple of years and writing a report. It's about identifying things that can be fixed ASAP, some short-term, some will take longer, but we're already getting our hands directly into it and making changes. It's all focused on, again, improving recruitment and retention, figuring out, getting our hands around just how many vacancies do we really have, just how many vacancies are we likely to have in the future, how reliable is that data that I just showed you, how can we create pipelines for people who are not yet in the workforce, say students, for example, or people who are new to the workforce for other reasons, maybe new to the country. How can we create pipelines for them to oral health jobs, raising their awareness of what types of jobs are there? How do you get training? How do you get experience? How do you advance in this field? We have a lot of folks involved in this process, including representatives of the Dental Association and several FQHCs and other dental providers. So these are the types of projects that we've taken on. Some on the right-hand side are focused on data. So again, trying to get a handle on how many people are really working and where are they working? Why do they leave? Where do they go if they leave? We can tell a bit more about the licensed workforce than we can about dental assistants. And we will soon be able to know more still, because we are going to start sharing the data, the licensee data, between the Department of Health and the EOHHS data ecosystem, as it's called, which also receives data from the Department of Labor and Training, wage record data. So we will be able to look at the list of licensed dentists and dental hygienists and match that with wage records to see, are they working in Rhode Island? If they're working in Rhode Island, are they even working in a healthcare setting, or are they doing something else? So that will be interesting information. It's only, again, wages. So, sole practitioners would not show up in that, but employees would. We're also collecting other data so that we have more information for folks about training programs that exist, how much those training programs cost, what are the requirements, and so forth. But in addition, we're doing a lot of partnership building and program development. We're expanding partnerships with the career and technical high schools to create the possibility of new programs to support and prepare people for jobs and careers in the oral health field. We're in the process of developing a career development day. So not only students, but others who are interested in looking for work or looking for a new job will be able to go to an event at the Nursing Education Center. It's an amazing facility if you haven't been there. The Nursing Education Center has all sorts of simulation labs and other capacities. So that's going to be a full day event on April 1st. And we definitely will have hands-on exhibits and ways for students and others to learn about jobs, training opportunities, careers in oral health. Some of these other projects are focused on expanding access to loan repayment so that eligible employers like FQHCs will be able to hire and offer loan repayment assistance to dentists. We are also working with the Department of Health to develop a program to help foreign educated health professionals, including oral health professionals, get re-credentialed to work in some capacity, at least in this country. So many new initiatives that are underway. I wanted to take a few minutes, one, to ask you a question, and then perhaps to share some thoughts. So if anybody would care to share what you think are the biggest challenges in the dental workforce.
This is
Sure.
Christy on behalf of the Rhode Island Dental Association. I would say probably one of the number one things that we hear at the association is that they're losing staff to other states. The second thing is the staff is just leaving altogether the field. We've had both in auxiliary staff as well as dentists in general have chosen to retire much earlier than they had anticipated, I would say, in a pre-COVID environment. They probably would have worked much longer. And now in post-COVID, they've just taken a look at things and said, you know, I think I'm done.
Thank you, Christy. And as I said at the beginning, and that just sort of confirms, there's options out there for folks. Some of that is about money and benefits. Some of it is about the nature of the work and people looking for different types of work experience or work environment. So what can be done? First of all, thank you, Christy, for your participation in the planning process that we've launched it. That is absolutely one of the things that can be done. This is, as I said, and as you know, not a problem that is unique to dental, but of course it absolutely is a dental issue, and therefore advocacy from folks in the dental field are really important. One of the things here we list are advocating for training and education programs. So there are some training education programs. Some might argue that there aren't enough, or maybe that they cost too much, or they're not in every part of the state, or they're the wrong time of day. Advocating for training programs that will be effective and that can support your agency or your practice, and thinking about ways that you can partner with those training programs, perhaps to raise awareness amongst trainees or people who are considering the field, maybe people in school, raise awareness about the field, the job opportunities, why you work in this field, why others work in the field. So maybe mentoring, maybe guest speaking, maybe visiting your workplace. All of those things are ways to promote and support training and education programs. Extremely valuable. Helping collect workforce data is really important. I didn't directly mention, but I alluded to the fact that we don't license dental assistants, and part of the challenge there is that we know less about our dental assistants. We don't know how many there are. We don't know how many are working. We don't know where they go. Having good data, participating in surveys is really a helpful way to support the entire field and the field of workforce development. Recruitment and retention strategies. I like to say that even when there are shortages and high turnover, there are some workplaces do better than others. So we can learn from those. I know we're probably tight on time here. We can wrap up here.
I just wanted to say thank you everyone for your participation.
Thank you, and to encourage folks to weigh in, participate. Your voice really does help to inform our workforce planning and make a difference.
So now I'd like to turn it over to Andrea Rohrer from Gainwell. Andrea is our Medicaid dental provider support representative, and she's here to provide information about enrolling and where to find resources. So take it away, Andrea.
Thank you so much. I appreciate it. My name is Andrea Rohr. I'm the dental provider representative for Rhode Island Medicaid at Gainwell Technologies. And I'm just going to try to graze over briefly just some introduction to Medicaid and some of the resources that we have. The agenda for today is introduction to Medicaid, enrollment, overview of billing and payment basics, billing policy, and I'll leave room for some questions at the end if there's time. The Rhode Island Executive Office of Health and Human Services partners with Gainwell as a fiscal agent to process Medicaid claims. We also help with enrolling and training providers, and we perform other duties to fulfill state and federal requirements. EOHHS has a sole responsibility for formatting program policies and procedures. If you're interested in enrolling as a provider, you'll need to gather up some documentation in order to do so. So we'll need things like your address information, your tax ID, so that's either your employment identification number or social security number, a completed W-9, a copy of your dental license, your NPI, your National Provider Identification Number, and you may also need to attach some federally required disclosures. So to enroll on, when you're going to enroll as a Medicaid provider, you would enroll on our healthcare portal. I've have the link on this slide as well. And we also, on the EOHHS website, there's healthcare portal resources too, a page that if you have any questions, anything that's on there, it's a great resource to use on our healthcare portal. If you are interested in enrolling with us as a provider, you would go to our healthcare portal page. This is what a screenshot of our healthcare portal homepage. I always tell every provider to make sure they open up the link to the provider enrollment user guide. That's right underneath the picture to the left. I always tell them to have it up right next to them as they're going through the enrollment application. So to enroll, you would click on provider enrollment. That's found under would you like to enroll as a provider, and then go through the application. So now we're going to talk about some billing and payment basics. So it's your job as a billing provider to do mainly, there's many things you guys have to do, but I'm just going to touch on them briefly. So you're going to verify that the patient is eligible with Medicaid. You're going to adhere to the timely filing guidelines, and your job is to submit claims to us. Verifying eligibility, we have a wonderful healthcare portal that's at your fingertips for your access 24/7. You can go onto the healthcare portal page once you log in. There's an eligibility tab. You can click on that, and you will need to input the member's Medicaid ID and the data service to check eligibility. You can also call our help desk. They're available Monday through Friday, 8 a.m. to 5 p.m. And there's a slide at the end that's contact information for them as well. So our timely filing guidelines. So you have 365 days from the date of service to submit claims to us. This is in order for us to process claims for adjudication. Any claims with a date of service over 1 year and a remittance advice date from Gainwell Technologies that's over 90 days will be denied for timely filing. Denials must be reasons other than timely filing to be considered. So this is just a slide to tell you that there's two different types of ways that you can submit your claims. You can submit them electronic or paper. Obviously, electronic has a quicker turnaround time. You don't need an original signature. We have a free electronic billing for your electronic claims to submit, and it's cost saving. But you can always do the alternative route, which is a paper claim as well. Billing policy and procedures. So some of the billing formats that we have. So if you're going to submit a claim electronically, you're going to want to submit it on 837 Dental. Again, like I said previously on the other slide, that we do have a free software. So if you don't have currently your own software that you use to submit claims electronically, we have a free software that you can download. There's instructions on the EOHHS website as well, so you can always utilize that free software for your claim submissions. And then paper claims, you can submit your claims on a paper form. We use the 2012 version of the ADA dental claim form that you will need to purchase, and you can purchase these paper claims at medical supply stores. Here's an example of a dental claim form. So we do payments to you when you submit a claim. You will receive reimbursement payments, EFT, that stands for electronic funds transfer. This is set up during your enrollment process. We also have a payment and processing schedule that's on the EOHHS homepage, and we also have that listed in our provider update as well. It's a great resource so that you know when to submit their claims and when you're going to receive payment for those claims. And lastly, you will, when you're on the healthcare portal, we have a remittance advice, and a remittance advice is so important for you to obtain. This tells you whether your claims are paid. This tells you whether they're denied, suspended. It gives you all the information about the claims that you just submitted. On our healthcare portal, we only house up to 4 of those remittance advices at a time. So you're going to need to, every financial that comes up, a new one will be uploaded and the old ones will drop off. So we always try to encourage our providers to make sure they retrieve those remittance advices when they're obtainable to them. And here is some contact information. You can always, if any questions that you have come up, you can email the provider services email box that's listed here. If you have any questions during the enrollment process, you can always feel free to reach out to me, or you can contact our provider enrollment department. There's our customer service help desk. As I said before, they're open Monday through Friday, 8 a.m. to 5 p.m. And my contact information is there as well. We have additional resources for you. You can look anything up on our wonderful EOHHS website, and you can also subscribe to our provider update. You can just do that by emailing our RI provider services inbox and just giving us your NPI and saying you want to receive updates monthly. We also have on the EOHHS website a provider reference dental manual. That is all I have for my presentation. Does anyone have any questions?
Thank you very much. You provided some great information. Okay, so next I would like to give the floor to Melanie Robinson. Melanie is a community health worker who is passionate about the great work community health workers can do to help with access. We talked a little bit last time about community health workers, but this is just an exciting way to address some of the challenges we hear from dental offices, including patients maybe not attending. Your work is extremely important. So take it away, Melanie. Thank you.
Hi, my name is Melanie. My name is Melanie Robinson. I work for CCAP Community Health. I'm a community health worker in dental. What a community health worker does is so important in medical and in dental. We are like a liaison between the patient and the dentist and anything that they might need. For instance, the community health worker will call the no-shows, see why they didn't come in, and if it's a reason like transportation or anything like that, we will connect them with social services in their area to try to get them rides, see what they qualify for so they can keep these appointments, and to explain to them how important the dental appointment is. Will interact anything related to with dental. I call the clients. I ask them like, oh, you have a dentist appointment coming up. What do they need to bring? I feel like a community health worker is very important in the dental setting because I'm the person when no one else has time, I will call them and find out like, okay, make sure you have this for your appointment. Bring this to your appointment. This is the time your appointment is. Do you have a ride? These are things that the community health worker can do for your dental clinic. Who hires us? Usually hospitals, community organizations, federally qualified health agencies hire community health workers because we are an intricate role in medical and in dental. So just in the dental setting, we try to go above and beyond to make sure that the office stays well booked with clients. We do outreach to not only clients, but I have a school-based program. We do outreach to children on the importance of dental health. The community health worker will also go out into the community and will be at health fairs and explaining how important it is to keep up with going to the dentist a couple of times a year, and if there's anything that they need or if there's anything that they need to know from their dentist, because sometimes when you go into your appointment, it's all jumbled, especially if a person's nervous, they already have a phobia of coming to the dentist. They might get all that information in, and then when they get home, it's gone. Whatever was said in the appointment, they might not remember. So I'm that person that they could call back and be like, hey, on my appointment, they said this, this, and this. Can we go over that again? Just because like it could have been overwhelming the first time. So that's really where community health workers do come in and do assist in making the process more smooth for them.
Oh, thank you, Melanie. No, that's wonderful. I mean, we've heard from dental offices, again, other than the rates, which was the largest thing we heard of why dentists, it's just not feasible to participate in Medicaid. The other thing we've heard over and over from dentists is it's just not feasible to participate if I make an appointment and the patient's not going to show up. So you're doing things. We so respect the time that the dentists are able to provide. We want to make sure that that time is used best for everybody. So your role is really critical. So thank you.
Thank you.
Any questions for Melanie? Last time we were fortunate to hear about work that in order for people to get jobs, it's critical for them to have good oral health. We all know that the role that oral health plays is critical. And so I'm pleased to welcome Abby Napton, who's going to talk about her experience as a patient receiving dental care. Thank you for being here, Abby, and sharing your experience.
Thank you so much for having me. I am really excited to share my experience. I share about my recovery all the time, and I never forget to talk about my dental health in that talk, because it is such an incredibly important part of me finding and sustaining recovery, is having the ability to get my teeth fixed. So really quick introduction. My name is Abby Napton. I am a person in long-term recovery. What that means for me is that I haven't found it necessary to use drugs or alcohol since February 20th of 2013. So I'm coming up on 10 years of sustained recovery. And as a result, my life is second to none. It is unbelievably different from the life that I lived 10 years ago. So I'm really, really happy to be able to share this experience, just a really quick version of my story and how it relates to oral health. So I grew up in Rhode Island, born and raised in Barrington. I graduated from Barrington High School, had really everything that I needed growing up. I had, some trauma, some mental health issues that led me to try marijuana at a young age. Shortly after that, I sustained a back injury from gymnastics and was prescribed opioids at the age of 14. What I found is that a switch flipped in my brain and I could not stop. From the time I was 14 to 16, I was using drugs daily and getting in trouble and not going to school. And I wound up in a residential facility for adolescent girls at 16 for the entirety of my junior year of high school. I learned a lot there. I learned about where I needed to go for recovery. I learned about what I needed to do in order to find and sustain that. But I wasn't ready. I was really young and I didn't want to commit my life to that quite yet. Needed to go out and do a little bit more research into why it was necessary, I guess. I ended up going back and using. I found myself addicted to heroin by the time I was 18. I was an intravenous user by the time I was 19, and also consuming really any other drugs that I could find. My life was really, really hectic and scary. I was homeless a lot of the time, couch surfing, did not have like a home based where I could, access the dental care that I needed. I definitely did not take care of my teeth. I did not take care of my body. I wound up, by the time I found recovery, I was about 97 pounds and had been in treatment many times. Something that always happened to me every time I went to treatment and found any clarity from using drugs is I would have agonizing pain in my teeth. I was using opioids, which is a painkiller. So something that happened was I would finally feel the pain that I could not feel due to numbing it, and I would be in so much pain. I found myself using ibuprofen to the extreme, to really, really the detriment probably of my liver, and did not know where to go for help. So I didn't have insurance. I didn't have dental. So I would go to community dentists, and I was 22 years old, and they told me that they wanted to take my whole top row of teeth and give me a full denture. It was really a terrifying prospect to me. And I had not found kind of my footing in recovery yet. 22 years old, I went to Anchor Recovery Community Center and was helped by a person, and my life just completely changed. I committed myself and said that this is the way of life that I want to live. And just like when I had started using drugs, I felt like a switch flipped in my brain and I was ready to stop. All the good things had come at once, where I got a grant for a recovery house. So I had a roof over my head. I had a bus pass. So I had transportation. I had people in my life who were doing the same thing as me and trying to commit themselves to a better way of life. And I had so much support and love from my family, who I had really abandoned during my active addiction. So finding and sustaining recovery did not necessarily mean that everything was, going to immediately turn to be great. So as I said, I had a lot of pain in my teeth. And if you want to show the photo that I showed you, that I shared with you, the before and after. So I was 22, and I always say that I did this interview where it ended up being in the Providence Journal. A reporter did a story on me for finding recovery at such a young age, and all the bad things that had happened as a result of my addiction. And one of them was my teeth. And she said that I looked like the Ivory Soap girl, except for my teeth. And they were cracked and broken. And I was, I was afraid to smile. I talked like this with my hand in front of my mouth. I laughed like this for years. So I was 22, and, I had been addicted to heroin for 4 years, and I had just completely destroyed my teeth. The bottom is now, that was 5 years ago, but that just gives you kind of it was a really shocking thing for my family, for my friends, and it really impacted my ability to find work, find any type of self-esteem where I felt like I could really seek out gainful employment or go back to school or do any of those things. I had a really, really tough time with it. And that article that was in the paper had been read by a dentist who ended up reaching out to me and saying that she did pro bono work for people who she felt deserved it and needed it. And the result is the bottom picture. So that was about 5 years of work. Just to give you the scope of it, I think I had 18 fillings, 6 root canals, 4 extractions, and 5 dental implants. So that, and the 2 bone grafts, and it's a lot. And I'm still in the process. I actually had 2 implants earlier this year that I still need to have placed. So what happened after I had my smile fixed in that way is that so many doors opened for me. So many things came my way. I ended up finding that I really love helping people, got into the field of treatment. I'm sorry if you hear my toddler screaming. He is absolutely wild tonight. He's in the background in the other room. But, as a result of this, I am a mom today. I have attended and graduated from school. I have a 2.5-year-old son who is the light of my life, and I'm pregnant with my 2nd child due in May. I have been able to give back what was so freely given to me and share my experience, strength, and hope with thousands of people. I've gotten on like dozens and dozens of stages and shared this story. And I always share about my dental health because it was such a huge part of my recovery and such a huge part of getting better was getting my smile fixed. And I watch people every single day in meetings and treatment programs who come in with their teeth just destroyed. It's a really hard thing. And it's so funny because I mean, I'm sure you all know that this is absolutely absurd, that your health insurance will cover your body from head to toe, but your teeth and your eyes are separate. And that's just wild to all of us. And only in this country is that true. But I will do anything I can to encourage dentists to help other people like me, because the way that my life was transformed is the ripple effect has been incredible. The lives I've been able to impact, my family's lives have been like improved. And it's just such a gift that you can give to somebody. I actually told a friend of mine who works at a methadone clinic that I was doing this tonight. And she said, "Oh my gosh, I'm so happy that you're doing this, because the people who come into the clinic now are like 18, 19 years old and their smiles are destroyed." And it's the drugs that we have out there today. It's the way that the world is, that we are unable to access the services that we need. And I just really hope that my story can help somebody, and that, we can see more transformations like this and the access is improved. So I'm so, so grateful and really excited to hear about all the work being done. I actually have some ideas that I'd like to share offline about the Recovery Friendly Workplace Initiative, getting involved with this, because I think that there is a huge, the need for dental health workers and the folks in recovery who are seeking higher education and higher places to work. That I think that could really be like a good partnership where we could find some people in recovery who would want to become dental assistants and dental hygienists. So definitely want to connect about that. But that's my story. I hope it helped somebody. And I'm really, really excited about this initiative and all the work being done. So thank you.
Thank you, Abby. We'll definitely take you up on a lot of what you said. Your story is really inspirational, and we really want this to be the norm, that we have programs available that dentists can use Medicaid as an insurance. And as Director Souza said in the beginning, this is just the beginning. We're improving the rates. We want more dentists to participate. We know it's not normal. And while we greatly appreciate the philanthropy of pro bono for dentists, that's wonderful. That may not be a system. That's not an ideal system. We want it to be just part of the flow. Our medical partners don't do, so many of them do pro bono, but we've established a system in the medical that it's covered by the insurance. Dentistry should be part of the body. So we're doing the work. We know it can be better. It's just the start. Like I said, we're very grateful for any pro bono work that dentists do, whether it's through individuals like you, whether through Mission of Mercy, whether it's through Donated Dental Service, Rhode Island Free Clinic. But again, having that door open, just as it is in the medical world, I think that's the ultimate that we'd like to see, that it's on par. again, this is just the start. We're grateful for dentists who participate in any way, and please reach out if folks have any questions. Thank you. And we get it. We know, especially at this time when offices are so packed, that taking on additional patients at rates that really aren't that great, but hopefully we're getting the ball rolling, and ultimately we can have a program that everybody's proud of in the future. So I'd like to turn it over to Sophie to add some comments regarding next steps.
Good evening, everyone. So yes, I'm just going to wrap us up for this evening to bring us back to a lot of the information that was shared in the first two town halls. As we said, this is a funded project that is available, and that has some funds available for individuals. And the two main things coming up that our dental professionals can partake in is the tuition assistance for the upcoming public health dental hygienist courses at the Community College of Rhode Island. The deadline to apply for those courses is January 21st. The first course starts on February 1st. There are 3 6-week courses. They are held mostly online, and I believe each course has 1 to 2 in-person sessions for the clinical component, but there is funding available for tuition support for individuals that are interested in becoming a public health dental hygienist. We encourage dentists to share this opportunity with their dental hygienists that they either work in their clinic, that they work with, that they interact with. If there are any hygienists that are interested in being able to provide care in public health settings and these community-based settings as well, we would love to be able to support people wanting to pursue that. And we have the opportunity to remove the potential barrier of a cost of tuition. And then the other main thing coming up is the community and home-based oral health pilot. As we discussed at the last town hall, there is a request for proposal, an RFP. It's essentially an application that will go out ideally by late January, early February. Individuals will have the ability to apply for the RFP. Dental clinics that want to participate in the RFP will be able to apply. There is a 30-day application period. People can ask questions, and then we will have to put out like a general question response sheet. That way we want to make sure every person has the equal opportunity to join in on the pilot. So that is step 1. Once the applications are submitted, we will review all of them and ideally award participants by March-ish. So once that RFP does go live, it'll be available on the Rhode Island Division of Purchases website. And I'm going to quickly show some screenshots of the website. So basically, you're going to go to ridop.ri.gov. This is our lovely homepage. You're going to click vendors and go down to all solicitations. Once you click all solicitations, you're going to click this little box on the left that says access to OSP bid board for Rhode Island Division of Purchases. And once you click that, it'll take you to the bid board search task. The text might be a little small, but it does say home and community-based services healthcare pilot. So if you search in those keywords, that RFP should go live. And once it is live, you can apply. And we encourage dentists to apply. We want as much participation to really get this proof of concept in place to be able to provide preventative dental services to individuals receiving care from home and community-based services. The key thing about this, like we've mentioned multiple times, is just creating a system that allows people to have consistent access to care is the biggest thing. And we want to ensure that people are getting care early, not having to use emergency rooms that we all know are not equipped to handle these complaints, and hopefully improve the oral health system for both our providers and our clients. To summarize everything here, like we said, these town halls have been recorded. They're going to be posted on the EOHHS YouTube page. The public health dental hygienist application at CCRI will be due the 21st. RFP will go live around February. RFP application will be due around February, March. Vendors will be awarded in March, and our year-long pilot project will begin in April. That is the timeline. And we thank you so much for joining these town halls. Just wanted to reiterate that the recordings are available on the EOHHS YouTube channel. We will be sending out a survey to everyone that registered just to get some feedback and find out additional information. People who have suggestions on how to improve the pilot, other ways to connect with dentists, other ways to make services better for our clients. We welcome all feedback. But before we formally end, I'm going to turn this over to Christy Durant of the Rhode Island Dental Association for some final words.
Thank you, Sophie. I just wanted to thank everyone for participating in this 3-part series. Also, just to encourage anyone that is on the call or that is listening to take time and see if this really fits into your schedule. As Sam had mentioned, we recognize everyone's schedule is full in this post-COVID environment. You guys already have full schedules. You're experiencing workforce shortages. Please understand that RIDA, EOHHS, the FQHCs, the DSOs, we are all working collaboratively together to address these issues. They are not lost in this, but that doesn't mean that we can stop the focus on addressing these patients that still need oral health attention and care. And so if everyone could just take a few patients in their schedules, that is a start. And hopefully it is something that we can collectively also address together. So with the rates having increased this past year in the adult population, hopefully it's just the beginning of rates and other things going in the direction of dentistry. But there's resources available. You can reach out to RIDA, reach out to Sophie, look on the EOHHS website, but know everyone is working collaboratively to make this happen. And we are all available for questions and anything that anyone might need. So
Thank you,
happy
Christy.
holidays to everyone, and thanks for joining.
I'm grateful for all of you who have participated this evening on this call, and very grateful for the dental community for all you've done over the past few years, and look forward to better things in 2023. I wish everybody happy holidays and have a good night.